Scientists around the world are worried and taking steps to tighten travel restrictions after a new coronavirus variant feared to be the worst yet was identified in Southern Africa. Let's listen in.
Just when the world was beginning to relax COVID-19 restrictions, a new variant of the coronavirus, which has been described as the most heavily mutated version, has been discovered. Authorities around the globe are alarmed by the new variant detected in South Africa, Botswana, Hong Kong, and now Belgium, which scientists say could be more lethal than previous variants. For this reason, Kenya has decided to change rules in all their points of entry. There will now be more rigorous screening of all passengers arriving from the affected countries, with physical proof of vaccination prior to entry a requirement for all inbound travelers.
We have continued to enhance our level of surveillance at our ports of entry, especially for visitors coming from the 3 countries. So they are going to go through a more rigorous screening process, including rapid antigen testing at the point of arrival, to ensure that if we have a positive case, then they can quickly be quarantined. We do genomic sequencing to be able to determine whether they have the variant.
In a statement, Acting Director General for Health, Dr. Patrick Amoth, also directed that all national and county health facilities prepare to handle a potential increase in the number of new cases.
It is likely that this variant may be able to do what we call vaccine escape, meaning that even if you are fully vaccinated, because of the change in its nature, then you could still be able to get the infection.
Other countries like the United Kingdom, the European Union, Israel and France have announced stricter measures and tighter border controls over concerns of the new COVID-19 strain, with Belgium confirming Europe's first case of the new variant of COVID-19.
I wish to stress that we're working quickly and we're working with a high degree of uncertainty. We are continuing to make assessments, including about those countries with strong travel links to South Africa. And we are working with our international partners, including South Africa and the European Union, to ensure an aligned response.
The World Health Organization has, however, cautioned countries against hastily imposing travel restrictions linked to the new variant, stating that they should take a risk-based and scientific approach.
And it is important to note that every travel measures should be always weighed, and that countries can do a lot already in terms of surveillance and sequencing and work together with affected countries or globally to work scientifically to fight this variant and to understand more about it so that we know how to go about.
WHO, which has convened an experts meeting to evaluate whether it constitutes a variant of interest or a variant of concern, is expected to share further guidance for governments on what action they should take. Scientists say the variant known as B.1.1.5-9 has 50 mutations overall and more than 30 on the spike protein, which is the target of most vaccines and the key the virus uses to unlock the doorway into our body cells. Meanwhile, the Kenyan government this evening received a donation of 834,130 doses of the Pfizer vaccine from the U.S. government. The vaccines were received by Ministry of Health officials led by Port Health Officer in charge at the JKIA, Benjamin Murkomen.